Namaskar, Jai Hind. I am Pratul. You are watching Knowledge Finder Pratul YouTube channel. Today anatomy topic is scapula and clavicle. Scapula is a very important and bone in our near thoracic case. So what is scapula and its location? Scapula is located near shoulder joint, near humerus. But we can also say near thoracic case. This is the, so guys, you can see the scapula. This is a scapula. This is a dorsal aspect of right scapula. So right scapula, dorsal aspect. The back of the scapula. Here we are seeing how we are identifying. This is the main topic. This is a crest spine of scapula. This is only back side. And glenoid cavity. This is a very important. Here you can see glenoid cavity. This glenoid cavity, shoulders joint and the humerus. The shoulder joints, humerus and our scapula fused or making this joint. So this is a glenoid cavity where the head of the humerus head located. This joint is also called the glenohumeral joint. So scapula has three borders, three angles or three process. What is the three borders? Three borders are the lateral border, then medial border, this is called medial border, lateral border and superior of border. Okay, then scapula has three angles. What is the angle? This is a inferior angle. This angle is inferior angle. This is a superior angle. This form is superior angle, and this is a glenoid angle or lateral angle. This joint is for glenoid angle. The side determination, we can see the features or the some characteristic, some bony portion of the scapula. We can see this is a acromial process and this is a coracoid process. This acromial process, this clavicular head attach the scapula, and here the suprascapular nerves, here the spinous process, and this is the crest of scapula. Here this is a supraspinous fossa. Fossa means the depression of a bone. This is called fossa. This is the lateral or back side of the scapula view. It is some convex like structure. This is called infraspinatus fossa. Then you can see in this is a lateral border, or in this space it is attached with clavicle, and you can see the suprascapular fossa. It is a depression of the scapula. Here in is this part is inside or this side, and dorsal aspect is this side. This crest of the scapula, this backward side, and inside is the suprascapular fossa. Then we can study what are the muscle attached to the scapula. This is trapezius muscle attached. This is the trapezius muscle. Here the upper border of acromial process. This is a acromial process. This is the upper border, and this is a middle border of scapular process. Is trapezius located in. And the supraspinatus muscle, where it is located? It is a medial 2/3 upper upper suprascapular surface or fossa, suprascapular fossa. This is the supraspinatus. The levator scapulae inserted in the surface. It is a lateral surface. The rhomboid minor and rhomboid major. This is a rhomboid minor inserted in medial border roof of the crest of spine. This is the infraspinatus. This is the muscle is a very important our shoulder joint. This is a from the shoulder joint or movement of shoulder joint. Infraspinatus is located the medial 2/3 of inter surface. It is intraspinous fossa. The coracobrachialis. This is the coracoid process. Here coracobrachialis and short head of biceps located in the coracoid process, and long head of biceps or deltoid biceps that near the glenoid cavity. In the teres minor, it is a very important muscle in our shoulder joint. This is a teres minor. This is the teres minor. Teres minor located lateral side, lateral 2/3 of dorsal surface, and teres major lateral 1/3 of dorsal surface. Latissimus dorsi located in the inferior angle. This only inferior angle is called. This is located in latissimus dorsi. And deltoid muscle and some others muscles in costal area by costal surface there, or this is near of the ribs. This is a subscapularis, very important muscle. Subscapularis, serratus anterior, medial border of costal surface, serratus anterior. And the muscles of the scapula and nerve supply of a scapula. Here seen the trapezius nerve supply, suprascapular nerve, and C3 C4 nerves. This is called nerve roots. And supraspinatus muscles. This is muscles and this is nerve supply of the muscle. Supraspinatus muscle in suprascapular nerve. This is C5 C6. Levator of scapulae. This is muscle is dorsal scapular nerve. Rhomboid major and rhomboid minor. Dorsal scapular nerve, and this is C5 nerve root, cranial cervical root, C5 ribs, interribs. Infraspinatus suprascapular nerve, C5 C6. Latissimus dorsi. This is called lats muscles inserted in scapula. This is scapula latissimus dorsi. It is the nerve supply of thoracodorsal nerve, C6 C7 C8. 3 nerve roots here. Here the teres major. This is the teres major. This is a lower side, lower of scapula. So you can see the lower subscapular nerve, and the teres minor. Here the teres minor. It is a axillary nerve near to axilla. Axillary crest we can use in physiotherapy. Axilla near to axilla. This is teres minor. Deltoid is a very important muscle in our here. In deltoid muscle, this is deltoid muscle. Is a 3 origin and 1 insertion. Next class we can describe all this muscle, clavicle or scapula, all muscles, origin, insertion, nerve supply and action, different type. So this deltoid muscle is a musculocutaneous nerve, C5 C7. Deltoid muscle is axillary nerve, and coracobrachialis. What is? This is a near coracoid process. Coracoid process named the coracobrachialis. It is a musculocutaneous nerve. It is a very important nerve in our body. The pectoralis major, the medial and lateral pectoral nerve. Pectoralis major. What is the pectoralis major? This is the pectoralis major, and inside the pectoralis major, this is the pectoralis minor. The subscapularis. It is the upper and lower subscapular nerve. subscapularis. It is the upper and lower subscapular nerve. The serratus anterior. In this muscle, this is serratus anterior. It is a medial or costal surface. This is a serratus anterior. This is a long thoracic nerve. This is a C5, C7. And biceps brachii, musculocutaneous nerve. Biceps brachii, musculocutaneous nerve. This is our nerve is a very important. Here musculocutaneous nerve, here musculocutaneous nerve. And next we are described as the clavicle. Clavicle is a long bone. As it has a sharp two ends, medial and lateral. It is a very peculiarities. This is a very disgusting or destructive bones in our long bones. So, what is the side determination of scapula? You can see the lateral end is flat. What is the lateral end? This end is flat. And end is large and quadriceps. This is a quadriceps, like a quad. This is a like lateral end is flat and like a quad. Then the shaft slightly curved. This is a you can see shaft slightly curved. Convex. It is a convex. This side, this is convex. It is a concave. Convex, concave. So here this is a convex, forward medial, and concave 1/3. The peculiarities of clavicle, it is a very important question for all STEM student. It is the only long bone lies horizontally. This is the only long bone. Here this is a long bone, humerus, radius alla, femur, all the bone is the gravity again. And this is the long bone which it is a anti-gravity, and it is this first bone is start ossifying, and only bone which ossifying is membrane. There is a no medullary cavity. So what is the nerve supply? Nerve supply today we are not telling this group of muscle. This is acromial end. What is the end? It is the acromial. It is a lateral 1/3 and medial 2/3. This is a superior aspect. This is a superior aspect. This is a inferior. Superior in front view. It is inferior in front in front of behind view. Here is the temporal ribs. Here is the bones like structure. This is the coracoid tubercle. It is a supraclavicle groove, and it is a impression for coracocostohumeral ligament. Here it is a very important. This area look like this butterfly like structure in clavicle. They easily determine this. And muscle, what is the muscle? It is a trapezius nerve supply, suprascapular nerve, sternocleidomastoid. It is a deltoid. You can see the axillary nerve. Now this is trapezius subscapularis, the sternocleidomastoid and sternal end. Sternal end, here the sternum start in our ribs. Sternal end. Here ribs start. Here the bound with coracoid acromial process, and this is here the humerus formed and make the joint shoulder. This is shoulder joint. Jai Hind, Namaskar. If you like this video, so please subscribe this channel. Namaskar.